People don't understand the difference between being born with a heart defect and acquiring heart disease as you get older. Everyone's familiar with heart attacks, bypass surgery, eating less fat, getting more exercise, all those things that are so well promoted. And they confuse that with being born with a heart defect. And they're really completely different things.
I've had 12 heart surgeries. I have a mechanical valve. I've had the Bontan procedure. I'm on my 4th pacemaker. 3 open hearts, and the rest were just small heart surgeries.
That's a very, very good question. So sometimes at the hospital, I go to an x-ray and then somebody looks at my body to see if it's all right. But if it's all right, then that means that I can go home. But if it's not, then we're gonna have to do a little bit of testes. So that's what having a heart defect is all about.
Looking at him and seeing his personality and his so much energy, it's not that big of a deal, but it's when you have the issues of the SVTs, like when he'll go into a high heart rate, that it just kind of brings you right back down to reality that yes, okay, he does have a heart defect, it is serious. So it's now educating the people that I send him to or that take him, or schooling, also blood thinners on top. So it's a little crazy, but I wouldn't change it. He's amazing.
But when you're born with a heart defect, you really can't do much about it, apart from, seeing a specialist and having operations, and maybe when you're getting a pacemaker or a defibrillator. Switching from butter to Basel isn't really going to be the solution.
It affects me because I can't play the other sports because my heart, and if I get hit the wrong way, I could either die or get really injured. So, and it kind of sucks because all my friends play the sports and I can't, because if I take the wrong hit, I'm done.
Because people have surgeries doesn't mean that, they're healthy and ready to go, a normal life, because you never know what lays down the road for them.
And not being aware of what we were made aware of today, that after 18 there's not much out there. So
that's kind of scary.
Of course, the frontier now is in the older patients with congenital heart disease. And in the current era, about 90% of children born with congenital heart disease will survive into adulthood.
From the children's hospital, then there's the adult care, and a lot of people get lost in that. I was very fortunate that I was seen every year since, and I'm blown away by the staff at both Sick Kids and Toronto General. It's just that they're very dedicated people, very, very special breed.
Around about 1 in 100 children are born with congenital heart disease, and another 1 in 200 develop heart disease during their childhood. And Sick Kids looks after all of those patients, essentially, that require surgery in the province, and other children that come to us from over Canada.
It's insane how many people are affected. Just not through the child themselves, but also through all the parents and the grandparents, friends and family. It just touches everybody's lives, and it just, it's challenging.
But what the pediatric cardiologists and the congenital heart disease surgeons do, they don't fix the heart, they don't cure the heart, they repair the heart. So these patients are left with problems, with a leaky valve, obstructed valve, abnormal heart muscle function, with heart rhythm problem, and we must take care of these issues when these patients are getting adults.
Today is Heart Talk, And it's a family conference that we've been holding. I believe this is now our 16th or 17th year that we've held it. A lot of these kids in school and in their community, they may be the only child with a heart defect. So it's important that they can connect with other people. Today we were bowling, and it's interesting to see because as the kids are talking to one another, they'll say, "So what's your defect? What's your defect? And what have you had done?" And some of them even boast about how many surgeries they've had done.
Oh, might be getting a new heart this year, and don't know when I'm getting my new pacemaker. The doctors tell me just take one day at a time, and I just do it, and we just go and have fun, and I do what I'm told and take all my meds.
And one of our previous patients, Jamie, who's now 28, and they went to the Clay Cafe, and she's trying to promote keeping the kids together and hopefully grow into a bigger support group.
My second surgery was in February of this year, and it was to put in a new valve. So I'm part cow. It's a cow's valve, so I think I'm part cow now by right. So moo.
And I'm one of the first generations with my type of heart condition with the transposition of the great vessels to survive to this age. And there are children who were born 10 years ago who are surviving. Had they been born when I was born, they wouldn't have survived that long because they have very complex heart disease. So there are going to be many more children coming through the schools and into the workplace with these heart diseases, and I just would like there to be awareness.
The way I see it is, it's better me than someone that couldn't deal with it. So if you gotta keep positive. That's all I can say. Keep positive. Technology's changing, medicines are changing. You never know. There's always something maybe out there that they can do.
Premature sense of one's mortality. So it can be very unsettling at times, but also it has been for me something that has spurred me on and has allowed me to get a great deal out of life and enjoy the friendships that I have, my family, all those things.
To the lay public or to a politician, I would say that adult congenital heart disease is not going away, and it's getting bigger. It's already bigger than some of the types of cancer that we would not think of not providing care for or providing adequate resources for. It's already a bigger number of patients than patients with cystic fibrosis or hypertrophic cardiomyopathy or multiple sclerosis. So those patients are out there. We would not conceive of not providing an adequate level of care for those other patient groups. And yet, for a while at least, and hopefully it's changing, and this video will help, the desire to provide care for adults with congenital heart disease has not really been there at a medical or a societal level, and I think that has to change.
The Canadian Congenital Heart Alliance was founded 6 years ago because the then director of the Congenital Heart Clinic at TGH collected a bunch of us together saying, you patients have to get involved. And we really want people who do have heart defects, who maybe aren't being followed by a specialist, to start being followed. So that's one of our messages, is that people, if you've got a heart defect, if you grew up with something that was wrong with your heart, you probably should be seen by a specialist to determine whether you need yearly follow-up or every other year before it's too late.